Rename Couva Hospital to honor its visionary, Honorable Prime Minister Kamla Persad-Bissessar, an editorial by Professor Wall Street. In the landscape of Trinidad and Tobago's healthcare system, few facilities have generated as much discussion as the Couva Hospital. This state-of-the-art medical center, conceived during Kamla Persad-Bissessar's tenure as Prime Minister, represents not just a building of concrete and equipment, but a vision for elevated healthcare standards in our nation. As public discourse continues around the facility's identity and purpose, here are 10 compelling reasons to rename the Couva Hospital as the Kamla Persad-Bissessar Children's Hospital. 1. Acknowledging visionary leadership. The Couva Hospital stands as a testament to Persad-Bissessar's forward-thinking healthcare vision. As the nation's first female prime minister, she recognized the critical need for specialized pediatric care facilities in central Trinidad, an area historically underserved by comprehensive medical centers. This facility was not merely an infrastructure project, but represented her commitment to addressing healthcare inequities across the nation. Naming the hospital after her would acknowledge the visionary leadership that brought this crucial facility into existence. 2. Recognizing political courage. Initiating a project of such magnitude required considerable political courage. Despite facing criticism about cost and location, Persad-Bissessar maintained her resolve that children's healthcare deserved significant investment. In a political landscape often dominated by short-term thinking, her administration's willingness to undertake a project with long-term benefits deserves recognition. The name would stand as a reminder that political courage in service of public health should be celebrated regardless of party affiliations. 3. Highlighting historic achievement. As Trinidad and Tobago's first female prime minister, Kamla Persad-Bissessar broke significant barriers in our nation's political landscape. Naming this hospital after her would connect this historic achievement with a physical institution dedicated to nurturing future generations. It would serve as an inspirational reminder to young girls receiving treatment that they too can aspire to leadership roles that shape the nation's future. 4. Emphasizing children's healthcare priorities. Throughout her administration, Persad-Bissessar consistently advocated for children's healthcare as a national priority. The Couva facility, with its emphasis on pediatric care, represents the manifestation of this focus. Naming it the Kamla Persad-Bissessar Children's Hospital would cement the connection between her administration's policies and tangible benefits for the nation's youngest citizens, while emphasizing the hospital's intended focus on pediatric medicine. 5. Creating historical continuity. Many healthcare institutions globally bear the names of their founders or key visionaries who made them possible. From Johns Hopkins Hospital to St. Jude Children's Research Hospital, founded by Danny Thomas, this tradition creates historical continuity and helps tell the story of how these institutions came to be. Similarly, naming the Couva Hospital after Persad-Bissessar would establish historical context for future generations about the facility's origins. 6. Bridging political divides. In our often polarized political landscape, the renaming could serve as a gesture of national unity and recognition that transcends party lines. Healthcare facilities serve all citizens regardless of political affiliation, and acknowledging the contributions of leaders from across the political spectrum demonstrates maturity in our democratic institutions. This gesture would show that we can honor contributions to national development regardless of party politics. 7. Establishing a healthcare legacy. The Couva Hospital represents one component of Persad-Bissessar's broader healthcare initiatives, which included expanded healthcare access, medical training programs, and infrastructure development. Naming the hospital after her would connect this physical facility to that wider healthcare legacy, providing context for how this institution fits within a broader national healthcare vision she championed during her administration. 8. Inspiring public service. When public service achievements are visibly recognized, it inspires others to pursue similar paths of contribution. Naming the hospital after Persad-Bissessar would serve as a tangible reminder that public service can leave lasting impacts on communities. For medical professionals, patients, and visitors to the facility, this association would reinforce the noble purpose behind public service and healthcare provision. 9. Acknowledging women's contributions. Despite comprising half of our population, women's contributions to national development are often under-recognized in public namings and monuments. Naming this significant healthcare institution after Persad-Bissessar would help address this imbalance, acknowledging women's leadership contributions to our nation's development. It would serve as a visible reminder of women's capacity for national leadership and vision. 10. Connecting vision with implementation. The journey from concept to completion for the Couva Hospital encountered numerous obstacles. Persad-Bissessar's administration not only conceived the project, but navigated the complex process of securing international partnerships, funding, and expertise to bring it to fruition. Naming the hospital after her would recognize both the initial vision and the persistent implementation efforts that made the facility a reality. In conclusion, a nation's institutions tell the story of its values and priorities. In considering the naming of the Couva Hospital, we have an opportunity to honor visionary leadership, recognize historic achievement, and inspire future generations. The Kamla Persad-Bissessar Children's Hospital would not merely honor an individual, but would acknowledge a pivotal moment in our nation's healthcare development and the leader who championed it. While some may view such naming through a partisan lens, we must rise above political divisions to recognize significant contributions to national development. The children who will receive care at this facility deserve to know the story of how it came to be and how one leader's vision created a space dedicated to their health and well-being. In naming this hospital after Kamla Persad-Bissessar, we would not just be naming a building, but affirming our commitment to visionary healthcare, recognizing women's leadership, and honoring those who transform bold ideas into concrete realities that serve the public good.